Hi, Dr. Sarah with Functional Wellness Center. Today I wanted to come on here and talk to you about disc herniations. We have patients who come into our office and they suffer with disc herniations. And we get a lot of questions on, what is a disc herniation? Can you help with a disc herniation? So I wanted to talk about that today. One, a disc herniation in the spine is when your disc, the squishy material between the bones, herniates. So it gets pressure on it and it bulges down. Now think of it like a marshmallow. So if you took a marshmallow and you squished a marshmallow, what happens to the marshmallow, right? The sides kind of squish down and it bulges out. And that's what happens in the spine. And when that disc bulges out, it puts pressure on the nerves. So if you look up here on, if you can see that right here on the poster, the nerves come out of the low back, they go down the legs, and they come out of the neck and they go down the arms. And so when you have that bulging in the disc, it puts pressure on the nerves that go down the arms and down the legs, and that can create pain down the arms and pain down the legs. It could be numbness and tingling, it could be sharp pain, it could be an achy pain, it could be a weakness in that area as well. And so there could be a few different things that could be going on that could be creating these disc herniations. One, it could have been an injury that you had. It also could be like a congenital anomaly. So something that maybe you were born with and it's affecting you now in life. Also, it could be from your spine not being in its proper alignment. So the spine should be in a proper alignment, and if it's not, if the spine is shifted forward or an area that should have a curve in it has straightened out, it will put pressure on those discs, and through time it can create disc herniations. Usually disc herniations are not something that automatically happens. It's something that happens through time, and all of a sudden one day, you'll wake up and you'll feel that pain down the leg or down the arm, or you've had chronic neck pain, you've had it for years, or you've had just some stiffness and tightness, and it evolves into something more. So let's look here. We have Dr. Andrew on the spinal decompression unit. So this is one of the therapies that we use for decompression. For disc herniation. So what this table does is it gently stretches the spine, and right now we're showing you the low back, but it'll gently stretch the spine in the low back, and it will create space between the discs so that the discs aren't bulging anymore and they don't have pressure on them. And then it takes pressure off the nerves that go down the legs. And it's amazing for disc herniations. It's helped a lot of people from preventing them from having surgery as well.
So you strap the chest here, then you have a belt that goes around your waist, so it holds your chest in a certain position, and then it actually this table separates, and you control the amount of poundage that you pull the spine apart. And then we also have the ability to affect certain discs by the elevation. Depending on where you want to target on the low back, you can change this elevation. So it actually feels really good, and it allows the body to relax and, like she said, take that pressure off the low back.
Yes, and it's one of the therapies in our office that is probably one of the favorites with our patients. We have patients fall asleep on this one too, and so it just feels pretty amazing. And we also do this, usually we can do this as just a separate therapy in our office, but normally we do it in conjunction with correcting the spine as well. So this helps to kind of calm down the inflammation in the area and in the disc and in the nerve. And then if we have more work to do, then we do, if you can see those tractions in the back, then we do some of the traction work. And we remold the spine back into its position that it should be in, and it helps your body heal fully. So that's all we got for you today. Hope you have a good day. If you want more information on our office, please go to Scottsdale, chiropractor Scottsdale, chiropractorscottsdale.com. Thank you. Bye.